Welcome, family. In today's knowledge, let's talk about how blood type, your rhesus factor, affects your pregnancy. Watch till the end as I talk more how the problem can be prevented. Please subscribe if you haven't. Like and share. Usually your rhesus, Rh, factor blood type isn't an issue. But during pregnancy, being rhesus negative can be a problem if your baby is rhesus positive. If your blood and your baby's blood mix, your body will start to make antibodies that can damage your baby's red blood cells. This could cause your baby to develop anemia and other problems. Each person's blood is one of four major types: A, B, AB, or O. Blood types are determined by the types of antigens on the blood cells. Antigens are proteins on the surface of blood cells that can cause a response from the immune system. The rhesus factor is a type of protein on the surface of red blood cells. Most people who have the rhesus factor are rhesus positive, and those who do not are rhesus negative. How do I know if I am rhesus negative or rhesus positive? As part of your prenatal care, you will have blood work done to find out your blood type. If your blood lacks the rhesus antigen, it is called rhesus negative. If it has the antigen, it is called rhesus positive. When the mother is rhesus negative and the father is rhesus positive, the fetus can inherit the rhesus factor from the father. This makes the fetus rhesus positive too. Problems can arise when the fetus's blood has the rhesus factor and the mother's blood does not. You may develop antibodies to a rhesus-positive baby. If a small amount of the baby's blood mixes with your blood, which often happens, your body may respond as if it were allergic to the baby. Your body may make antibodies to the rhesus antigens in the baby's blood. This means you have become sensitized and your antibodies can cross the placenta and attack your baby's blood. They then break down the fetus's red blood cells and produce anemia, a condition that happens when the blood has a low number of red blood cells. This condition is called hemolytic disease or hemolytic anemia. It can become severe enough to cause serious illness, brain damage, or even death in the fetus or newborn. Sensitization can occur anytime the fetus's blood mixes with the mother's blood. It can occur if a rhesus-negative woman has had a miscarriage, an induced abortion or menstrual extraction, an ectopic pregnancy, chorionic villus sampling, a blood transfusion. How can problems be prevented? A blood test can provide you with your blood type and rhesus factor. Antibody screen is another blood test that can show if a rhesus-negative woman has developed antibodies to rhesus-positive blood. An injection of rhesus immunoglobulin, RHIG, a blood product that can prevent sensitization of a rhesus-negative mother. Rhesus immunoglobulin is used during pregnancy and after delivery. If a woman with rhesus-negative blood has not been sensitized, her doctor may suggest she receive rhesus immunoglobulin around the 28th week of pregnancy to prevent sensitization for the rest of pregnancy. If the baby is born with rhesus-positive blood, the mother should be given another dose of rhesus immunoglobulin to prevent her from making antibodies to the rhesus-positive cells she may have received from her baby before and during delivery. The treatment of rhesus immunoglobulin is only good for the pregnancy in which it is given. Each pregnancy and delivery of a rhesus-positive child requires repeat doses of rhesus immunoglobulin. Rhesus-negative women should also receive treatment after any miscarriage, ectopic pregnancy, or induced abortion to prevent any chance of the woman developing antibodies that would attack a future rhesus-positive baby. What are some other reasons rhesus immunoglobulin may be given? If and when amniocentesis is conducted, fetal rhesus-positive red blood cells can mix with a mother's rhesus-negative blood. This would cause her to produce antibodies, therefore making it necessary for rhesus immunoglobulin to be given. A rhesus-negative mother may receive rhesus immunoglobulin after birth, even if she decides to have her fallopian tubes tied and cut to prevent future pregnancies for the following reasons. The woman may decide later to try to have the sterilization reversed. There is a slight chance the sterilization may fail to prevent pregnancy. In case there is a need for a blood transfusion in the future, the treatment will prevent her from developing antibodies. What happens if antibodies develop? Once a woman develops antibodies, Rhesus immunoglobulin treatment does not help. A mother who is Rhesus sensitized will be checked during her pregnancy to see if the fetus is developing the condition. The baby may be delivered on time, followed by a blood transfusion for the baby that will replace the diseased blood cells with healthy blood. For more severe cases, the baby may be delivered early or given transfusions while in the mother's uterus. How common is the Rhesus negative factor? More than 85% of people are Rhesus positive. The Rhesus factor does not affect a person's general health. Problems can occur during pregnancy when the baby's blood has the Rhesus factor and the mother's blood does not. However, it can be prevented in most cases with the medication called immunoglobulin. Want to know more? Subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy.